All right. Well, it is good to see you all. There are a lot of familiar faces, but there are also some folks that I've never met before, and that's really exciting. My name is Sarah Markle Elder. I'm with AFT National. I do occupational safety and health for healthcare workers only because you're the best division in my view. Don't tell anybody I said that. So we are here to talk about using the workplace violence law that Connecticut has. And Sherry has joined. Sherry and I have had quite a journey, working together, her doing most of the work really, to get the workplace violence committee at Bacchus to actually be what it's supposed to be. And that's really an ongoing process. But this is an exciting prospect to get to talk to you all about this law. It's not a new law. It's been around for a while. But like a lot of things, we have tools that we're so overwhelmed by other things that we forget to use. No, you don't know, you were never told, or you're busy with the day-to-day stuff and you don't know that you have this tool. This is a really excellent tool. Connecticut is one of only 9 or 10 now states that have workplace violence prevention laws. There are lots of states that have felony laws that make it a felony to assault a healthcare worker or an RN or whatever. And those are important too, but in our view, this is really critical to get to impress on the employer their role in preventing workplace violence. So I'm talking a lot again. So let me just stop and ask folks what your experiences are. And is everyone here? I mean, there are folks I do know. I know Dale and Janice and Heather and of course Sherry. Is everyone else a local leader? Is anybody rank and file, or is everybody here today local leaders?
I'm staff. I'm from AFT Connecticut.
It's nice to meet you, Ed.
Thank you.
So
you probably already know that I'm staff too.
Yeah. Everybody else is a local leader? Okay. So before I pontificate too much, has anybody had the opportunity to use this law? Other than Sherry, because she's using it for all it's worth. Yeah. And okay, so does anybody have an active workplace violence committee or a workplace safety committee that specifically works on workplace violence going on? Okay. Janice does, Danbury. Oh yeah, so Rosemary has filed or shared a toolkit that has a bunch of stuff. Okay, so Lisa Foster's from Bacchus. Great.
Heather Hallett is from Wyndham.
Cool. Great. So sounds like, this is not unusual that folks, I think particularly after COVID, even if employers were, sort of doing it before COVID kind of, upended everybody's intentions to be doing this because it, took all of the oxygen away from everything else. Hey, Bill is with us. So now we can really get started. Anyway, so losing my train of thought here. So this is, not unusual. Folks are not using this law, but we want to use it. There are some limitations with it, but it's really a good tool. So let me pull up my PowerPoint and put it in slideshow. And can you see it?
I love that you know to put it in slideshow.
Well,
I'm so happy.
Doesn't seem to be in slideshow though.
If you go to across the bottom, there's like a little
There.
presenter. There you go. Oh, you got it. See?
All right. Okay. Cool. All right. So that's just the first page, and Yep, that is not working for me. All right. So OSHA, has been around for a while. I haven't really asked folks. I mean, do folks feel familiar with the basic idea of what you're supposed to do? Let me stop share for a second. I really want to have more of a discussion rather than a webinar. Do folks feel like what's supposed to happen with workplace violence prevention? Because I know for some folks have heard my basic workplace violence prevention webinar before. I've been doing this for a while. So, all right. So OSHA has been providing guidance on this since 1996, when none of you were born yet, right? And they've updated it every few years. Back in 2016, AFT led a coalition of unions to petition OSHA for a standard, and we're still working towards that. Unfortunately, it's taking a long time. It didn't progress during the Trump administration. As you know, your wonderful member of Congress, Joe Courtney, has sponsored a bill in 2 Congresses and got it passed in the House twice that would force OSHA to work faster. And it'll come up again in, actually possibly pretty soon in the House. But it's an uphill battle. So in the meantime, we've got to use the tools we have. And I'm going to go back to the screen share. There we go. All right. So the process, whether we're talking about the law or OSHA's guidance, is really the same. It's really OSHA's process for a lot of things. And it goes like this. It's a repetitive process, and labor and management need to collaborate. OSHA thankfully understands that it's really critical for management to listen to workers. Workers are the ones on the front lines who know the issues and the solutions from firsthand experience. I don't think any other federal agency understands that the way OSHA and the Department of Labor do. CMS certainly doesn't, HHS doesn't, CDC doesn't, and not that it's a federal agency, but the Joint Commission doesn't either. They tend to offer things that are very top down. So it's great that OSHA and the state law require that that workers, and in your case, because you're unionized, that it's the collective bargaining agent who is at the table. So you come together. The employer has a duty to make the workplace safer. Employees have a duty to try to follow the employer's policies and procedures. So the second part is that you're assessing risk using data. It's like anything else. We apply data-driven solutions, and management may be tempted to just say, hey, we've got this committee that we're supposed to have, and let's just pilot some panic buttons, or we're going to purchase a system that's going to create a locking system on all the doors. They implement it without really taking the time to look at where it's needed, if it's the most effective control for that particular location. They just do it. That's not how we want to go about it. We want to gather the data, look at where the incidents are happening, figure out what the site-specific solutions are. So you look at training as well, because I don't know anybody, frankly, I haven't heard of anybody ever saying, I've had too much training, I feel just fine, don't give me any more training on this. I don't know if that's your experience, but people generally tend to say we get computer modules, it's multiple choice or true false. It's not the skill building training that we need on this. So the next part of the process is that the site-specific solutions are implemented, and then you do evaluation. You continuously upgrade and improve the program, or at least you do it on an annual basis. And if there's a major incident, that's really a wake-up call that it's time to look at the plan again and maybe tweak it a bit. So let me move it to the next one. Why is this is my issue that I just seem to have. There we go. All right. Let me move you guys a little bit. Oops. Why did it do that? There we go. So smooth. I'm just ready for prime time. All right. So this is, again, this is a repetition, but and if any, I know that Dale and Sherry and a few other people were part of the presentation about 2 months ago that your attorneys made. They basically covered the same ground, which is why I didn't want to spend too long on the specifics of the law and more time on how we can get it implemented. So the law specifically says the employer needs to convene a new or an existing workplace safety committee. So, for example, at Bacchus, I think they have a specific one, but it could be part of the regular health and safety committee. They have to conduct an annual assessment for risk factors, and that means a review of data. They need to develop a prevention and response plan in collaboration with the committee. They need to maintain records, meaning they keep a log, and they have to report that to the Department of Public Health annually. A lot of folks don't know they are supposed to be reporting assault to the police within 24 hours. That excludes people whose if the perpetrator is their action is clearly a manifestation of dementia or mental illness or something like that, that is excluded. And then there's also a provision in there which probably has never been followed, that the employer is required to adjust patient assignments or provide support for a worker who's been abused or threatened. So meaning, like, if you were threatened by a patient and you go to the manager and say, I don't want to deal with Mr. Jones, and your manager says, oh, certainly, I'll just switch things for you. Or, well, we don't have enough staff to switch, but I'll put somebody else in the room with you so that you're not all by yourself with that person. That's probably not been followed at all. And the language itself is very soft in the law. So the committee has to be 50% or at least 50% people who are, direct care workers, or at least non-managerial. And the committee needs to be meeting at least quarterly. So let me stop here for a second, because I want to ask folks, and I know it's really hard when we're doing this on Zoom, but it's really helpful to hear from you. Like, what is your experience? Like, and maybe, okay, go ahead, Janice.
Hi. So we've had a lot of bad things happen at Danbury Hospital. So we utilize our workplace violence committee very well. And we, as the union president, I work very well with the director of the security department. And he does tell me that sometimes he gets pushback from administration, but because he works with me and he works with them, he's going more towards the people who are actually at the bedside. So I have them doing 2-hour rounds now through the hospital because the families have been very obtrusive and just everyone's like in your face. And I just feel since COVID, they all feel entitled and privileged. And so there have been a lot of aggressive patients, aggressive families. So they do their 2-hour rounds, which administration said they don't have enough security for that. And the security department said, oh no, we're going to do that. And we're going to hire 2 more people. So administration wasn't happy about that, but they did indeed hire 2 more people. Excuse me. We also, with these, with this law that I learned about from you, Sarah, thank you, that we're able to request that someone goes into the room with us when we have a patient who is a little violent. So we do have the security come up with us when we go in, or we bring a manager in with us, because I said, we are so short-staffed, we need someone to come in with us. So sometimes it's going to be our head nurse or our assistant manager. So they usually will get security up to the floor because they don't want to go in with us. But those are things I learned from you. So thank you.
Oh, well, thank you. Sherry, could you talk a little bit about your experience with trying to get them to one, for first part was just actually letting her get to the meeting. And then there was a lot more.
A
that followed.
complete nightmare. It literally took me over a year just to get on a meeting. So multiple months I was at labor management requesting to know when workplace violence committee meeting met. After several, like probably at least 3 or 4 months, I finally got an invite to it. Then for a good 6 to 8 months, every time I went to it when it was supposed to be, nobody was in the room. And apparently they just cancel it willy-nilly at the last minute, and then they change it to a different day. And then it's just, it was a nightmarish. So then I requested that they give me the minutes to these meetings to make sure they were actually going on. And I never actually got minutes to the meetings. What I got was like a blank agenda. Like when I say agenda, I don't even, it was like a very generic thing, like basically like, we do like introduction type of thing. And then we do like, what do they call it? Like good and bad things that happen in the meeting is at the end of the meeting. Like it was, but a jury, there was nothing filled in between of them. It was, I have a feeling that they just weren't really having them. I'm so sorry. Hold on 1 second.
Okay. I'm sorry, was it Jessica? I took the chat off my screen, but yes, Victoria, if you could want to share with us. Oh, Sherry's back.
So sorry about that.
Okay.
So and then after I finally got to like the first meeting, there was like me and one other frontline person there, and all the rest of it was managers and security managers and HR. Like nobody, frontline people were really there. When I looked at the invite list on the emails, they were like nurses that hadn't been there for like a year or more on that email list. So then I started, giving out information that, thanks to Sarah, she kept giving me like what the law and the intent of the law was. And it probably took me at least 3 to 6 months to get them to really take a look at the information. And then me and Logan met with security and HR to talk about how to revamp this committee to actually be following the intent of the law. And the last one we had last month, finally, we had some upper level management there. And basically they had agreed that we needed to review the committee. And so the next committee is supposed to be 50-50 frontline people. They're supposed to make sure that the people were able to get off by getting coverage so they can be at the committee. And that what we actually talk about the committee would be incidents that occur, would do a root cause analysis on those things, and then come up with solutions that are voted on the committee. So the next meeting, we'll see how this goes, but at least we're making some traction. It's been very slow and painful, but we're making some traction. Even in the first couple of committees I met, it was basically them just telling us what their plans were possibly for the future. And the 3 times I went that they had it, basically it was the same thing. Like, we're gonna get a dog that knows how to sniff out guns, but like the dog just arrived like now and they gotta train it. And so it was very slow moving and we had no say in what was happening. And we did not review any of the incidents. I did request the OSHA 300 logs and their workplace violence logs. It took me a long time to get those with multiple requests and a threat to file a ULP. And then finally I got them. The problem is that the OSHA 300 logs are not specific to workplace violence per se. So you had to filter through all of that. It's quite a bit of information. Thank God Sarah helped me do that. And the workplace violence logs that they had were just numbers. So like the year 2017, there were 49. That was it. Like no details, no nothing, no departments, no. So I did show them, that we were supposed to have departments and that, supposed to we should know what the incidences are so we can discuss them. So it's been a long haul, but we're making baby steps.
That's great. Victoria, you want to add more?
Yes, I do. And oh, thank God for you, Sherry, because I have been very much shouting at anyone who will listen to me for months now. So those of you who don't know me, hi, I'm Victoria. I'm an E3 nurse at Bacchus, so I do step down unit. I'm one of our more senior nurses on the floor now. So I've been here almost 3 years. And what I have, I came from Middlesex, which does all of the work, like they do healthcare worker violence and healthcare safety research. Did my EDP on research, and there is it's something I just keep on bringing up different pieces of puzzle that we are sorely lacking at Bacchus. There was an administrator, upper level, I had never met before, that came around about a month ago and was interviewing the staff with some analyst, and they were taking furious notes with us and asking us what we would say needed to happen for us to say we were satisfied with management's visibility on the floor. And I turned it into a 40-minute conversation about every single step in the process of what they are doing wrong or not doing at all. I have asked to be on the workplace violence committee multiple times. I am getting nowhere. I have asked again on the mutual agreements committee. I've been nowhere with that. I have suggested screening tools, education, onboarding, including teaching people how to file a risk connect, because that's not done. So why are we having to learn an entire new system just after we've gotten beaten or abused or anything during our day just to file it? And the fact that this committee that doesn't even meet and are with managers who don't ever come to the floor don't know that any of this stuff is happening because they've made it impossible for us to tell them. And I was very abrupt and very blunt in explaining every single step of what we need to do to fix this, and giving them multiple suggestions of ways to be more transparent and enhance communication. And I was applauded. I was given emails and a couple of follow-up emails saying, we're getting this information for you, and then crickets. So I'm trying, but it's not, the information is not disseminated to the floor nurses. And when you say, hey, this person threatened me, can we kick them out? It depends on who you're talking to, and depends on what day or what shift you're dealing with which managers will tell you if you can actually put in the more extreme measures to keep us safe. So that's what my experience has been in the last couple of years. And it just keeps, I feel like I'm going in circles.
Yeah.
I can relate.
Thank you for sharing. Yeah.
Victoria, I just wanted to let you know, I just sent you an invite to the very next Workplace Violence Safety Committee, which is going to be in the conference room 3 on April 17th at 3:30. You are now officially invited.
Thank you.
Does anybody else have experiences they want to share related to the committee? They're getting on the committee, knowing if management's actually holding the committee. So, go ahead.
Listen, or not. They don't tell us, they don't announce that there is zero communication between most of the committees that are running at Bacchus and the nursing staff. So
Right.
just
Right.
across the board is they are ghosts.
Right. So one of the things I've noticed, when we negotiate some kind of joint labor management committee, it's very clear from the very beginning that this is not management's meeting. But when it's a state law, or if it's, for example, there are a few states with state OSHAs that, require a joint labor management committee for health and safety for everything. And because it's legislated or it's a law, management kind of treats it as if it is their committee. They schedule it. They may or may not be good about notifying folks. They may appoint people in order to fill those 50% seats, and that's not okay. And I was wondering if anybody could speak to your experiences with getting management to respect that this is the union's role to appoint their folks to these positions. Does anybody want to speak to that? Or maybe that's not as much an issue. Heather.
Hi, Sarah. So at Wyndham, we have some of the same problems that Sherry's having at Bacchus. So a couple years ago, when I started as president, I kept pushing the issue after attending one of your meetings because I said, you know, we're supposed to have this safety meeting, a safety committee. Where is it? Oh, we have one. With who? And it took me a lot of pushing to finally get them to start having it. But the same thing where we had it set out scheduled for the whole year of when we were going to meet. And then that the morning of the meeting, 9 times out of 10, they're canceling it and rescheduling it.
Mhm.
So then I have to again go forward and start arguing again the point that we need to have these meetings. When we do have them, I mean, they collect a lot of information. Not a whole hell of a lot gets done about it, but they don't like me because the area I'm in now has been neglected for a very long time. And so now they're showing their, you know, security's now coming down and checking several times a day just to see how we're doing since we're not really connected to anybody else. So we get things done kind of sporadically. Things will seem like it'll be going good for a couple months and then we're right back to the canceling again and me having to really hunt around trying to figure out when, you know, if they are meeting and when. I put up enough of a fuss. They didn't really they don't really care who comes to them. I can bring whoever I want to the meetings when they do have them. So it slowly is getting to be more than just me and security. So now I've got, you know, some other nurses and stuff have been involved in a few times, but it's still frustrating that so much effort has to be put into just keeping it happening.
Well, thanks for sharing that. Do they give you an opportunity to, well, basically have shared governance, you know, a voice in what's on the agenda?
Oh yeah, I can. Yep, I can send them ahead of time. We'll have an agenda. You know, they have like their agenda. I have mine. When we start, you know, we kind of go through a lot of, you know, any incidents, and they've been pretty good at Wyndham where we do have very, you know, it's been very specific where we go over what happened, you know, what the end result was, or if we haven't gotten to an end result yet, what should be happening with, you know, the incidents.
That's good. Do other folks have experience you want to share with that part? Okay. So yeah, I mean, it seems like it's really harder than it ought to be, but you know, the law is very clear that this is a collaborative process. It's not management's committee. It's not management's purview entirely. Now, the law does not specifically say that you know, management has to do everything that the committee says, but it is clear that you know, they take advice from the committee. Now, I want to take a moment to say that, you know, there's a fact sheet in the toolkit. CMS and Joint Commission recently updated their information. The Joint Commission does have workplace violence standards. They do not speak to you know, workers having a voice in the process, but it's otherwise the same model. You know, they get data, they, you know, look at where the incidents are happening, you know, apply a process to determine the best solutions in those locations, and they improve training and they evaluate, you know, what's working, what's not working. So yeah, so you have more than one tool here, really. One of the things that struck me in the situation that Sherry was dealing with at Bacchus, she kept like as she mentioned, like they were sort of acting like they didn't really know what they were doing. They, would present some information and they would talk about some stuff. At one point, they were gonna get machines, I think, to screen for guns, if I'm remembering correctly, Sherry.
Yeah, they were almost, they're not like metal detectors, but they trialed these things where they put this screen that when you walked by it, a big yellow circle would go around the section where they thought you might have a weapon. But like water bottles could set it off, a laptop could set it off. And the thing is, it's just like this little screen, so people could circumvent it pretty easily. And then they're manning it with a security guard who is armed with pepper spray, and these people potentially could have a gun. So like, I don't understand, other than if we're using the security guards now as body,
Yeah.
like,
So,
I don't, it just doesn't make any sense to me, but
Yeah.
they trialed it for 2 days and then pretty much said it was too expensive for them to buy at all entrances, and that they were gonna take it back to the main, there's some meeting in the HHC world where all the head of securities meet, and they were gonna they all trial something different. Like one of them, like a couple people trialed the screen in HHC, and then other people trialed like a TSA type of thing where you had to go through, like your belongings had to go through the little camera thingy.
yeah.
So they were all
Yeah.
bringing all that information back.
Dale, you want to share something?
Well, I mainly want to ask something. I'm frustrated because 20 years ago, I feel like we at our hospital, since Yale took over, we've stepped back in time, and the arguments that we had 20 years ago are resurrecting.
Mhm.
The things we knew should be in place aren't in place anymore. The head of the emergency room, from what I hear, and I see Connie, Mitch, Vanna on here, all the people that work with me at L&M. This head of the emergency room wants the emergency room, which is new and being renovated. So they came up with this new waiting room, look more like a hotel on arrival than a hospital. And we fought really hard to protect our people that are manned triage in the waiting room. And we had built them where they were enclosed with rear exits. And now in this new emergency room, waiting room, they're sitting open target at a desk with just a little plexiglass in front of them. And the security is in a locked office. Well, now they're leaving the door open because a couple things happened. And the whole design, we asked over the last 2 years for staff to be involved in stuff. They won't have a metal detector. This doctor doesn't believe in it. And I'm wondering if there's some rules and regulations that we're missing with this new design of our emergency room. I'm really concerned about it.
Well, I wonder in that case specifically if there might be Joint Commission requirements. Maybe if you could send me an email with the specifics about that. We purchased the 2023 version of the Joint Commission standards, so I can do a little digging. But I think that part of what you're getting at is that, they do what they do. They don't necessarily consult you. It's, really difficult. It sounds like for those who have said, yeah, we're doing it now, it took a long time to get to the place we're at, that, to get them to actually meet. One of the things that seemed to turn the tide for Sherry in this her banging her head against the wall with them. And maybe I'm wrong, but she gave them a whole bunch of the OSHA guidance. There's another document in your toolkit called the OSHA roadmap, which is basically the same thing as the OSHA guidance. It's just kind of prettier, and it's sort of written in management language, and gives them examples of, different ways they can implement the guidance. It seemed to me that they really didn't know what they were doing. They had no idea that there's this framework out there already, which is fairly well researched and proven, that when you apply data driven solutions, you're not going to eliminate all examples of violence, but you can reduce some. You can maybe prevent the worst things from happening. So that, in your toolkit that's there in the chat, there's the guidance from OSHA and this thing called roadmap. And you may want to offer this to management to say, are you aware of this? Boy, it's all laid out here. We don't have to reinvent the wheel. So I don't know if that's the case, but we've been talking for a little bit. You guys are the ones who do this work. You're the ones who have to interact with management. You're the ones who, deal with grievances, you negotiate, you deal with labor management, you know this stuff a lot more than I do. And I'm wondering, what have been the successful things you've done that maybe took a while, but have enabled you to get them to respect that, like, okay, this is a process where we are equal partners at the table. We have an important role here, and we want to do this systematically. We are not interested in wasting time, canceling the meeting at the last minute, not really dealing substantively with the issues, not spending the time to look at the data in a meaningful way. Do folks have any, experiences you want to share that might, maybe not the exact same thing, but something similar, where you have had to work at getting them to work productively rather than wasting your time? Yeah, Sherry. Oh, that you're on
That's
mute.
not really Sherry. That's somebody I sent my link to. So
Oh,
whoever
okay.
has their hand raised, you can unmute.
Yeah, go ahead.
My guess is Bill Garrity.
Oh, okay.
No, it's Andrea.
Oh, hey,
It's
Andrea.
Andrea Riley. I'm sorry, I don't know how to put my name on the phone. I'm not
You
good
just
at
hit
any of this stuff.
participants and then click
Okay.
on your name, and then it'll say rename. But just go ahead.
Okay.
You can be
I'll do
me.
that for next time. Okay, that's a good thing. Okay, so I know that we have been dealing I work in the emergency department, and I'm a nurse at Wyndham and the president for their union. It's funny because I'm listening to Heather, and she's the union president for the other union, and I was just texting a couple other union members, and I'm like, do we have a workplace violence committee? And I'm like, well, Heather just answered that for me. We do. However, in the emergency department, we have been working with security, and more so in our psychiatric area, because that's where a lot of our violence is kind of centered. It's not just secular to that area. They have brought wands to wanding our patients, and we have found ways to kind of revamp the area to make it safe for egress out of that area. We still fight. I don't want to say we fight, but we go back and forth as to the level of security's responsibility, especially when a homicidal patient or somebody that has said, I intend to hurt other people, come into, because that's when you start. That's when you start the safety, correct? And it's a matter of at what point the nurses we're no longer safe. So at what point does security have to stay and be ever present in that area? And I understand that they also are limited with their resources as well. But the primary focus is to handle a situation. And right now, if that's where the fire is, that's where you need to be at the moment. We've kind of come a long way. But I do have a quick question for you. You talked about in one of your slides, it says the exclusion of mental illness. Is that if there is someone who committed violence against a staff member was mentally ill, that is not reportable. Is that correct?
That is correct, unfortunately.
And
The-
what degree of mental illness?
Well, let me see if I can find the exact language, because I was truncating it a lot because it was PowerPoint. So it basically says something about, a direct manifestation of the patient's, okay, here it is. The employer must provide, no. Okay, acts committed by a person with a disability whose conduct is a clear and direct manifestation of the disability are excluded. So it means, so if I come in and I'm not acting like I have dementia or psychotic or something like that, and I assault you, the employer is obligated to report my actions within 24 hours. But if I come in and it looks like I'm psychotic or something, then the employer is not obligated to report that.
Okay, so like a state of psychosis. Okay.
Yeah.
Because I find that, I mean, I guess you'd have to look at a diagnosis and, can then as a, if you go and take it further with workplace violence, if somebody says, well, I'm mentally ill. I mean, at what point is it then, but there are people that suffer from mental illness that are very much functioning members of society and can delineate between right and wrong. My next question is that they file a report. And that the hospital is required within so many, was it 24 hours to file that report?
Right.
Are they required to provide a copy to the person who was assaulted?
No.
Okay.
That's actually a great thing. John Brady asked me a few months ago, what I'd like to see changed in the law if there was an opportunity in this legislative session to go back and make updates. There were actually updates in 2015 to this law. And there were a couple of things related to, like, for example, there's no definition of workplace violence in the law. So, I would recommend that Connecticut use OSHA's or NIOSH's definition, or even the Joint Commission's definition, so that employers can't create their own definition that would exclude too many cases.
Right.
Did you have more?
Just
I
one
did
more
wanna
thing.
say-
Oh, go ahead.
Let me just
Actually,
say
no, that's
one
fine.
thing
Go
to
ahead.
that, Andrea, so Hartford Healthcare does not do the reporting. They don't report at all unless you decide you want to press charges. So that's something I worked with management, saying the law does not say that you only are going to report if the person who was assaulted wants to press charges. The law says you'll report every act of workplace violence to the police, which is totally different than someone pressing charges. So a police report can be filed for anything. It doesn't mean that charges are filed. And the police can charge somebody with something, whether or not an individual wants to press charges. So depending on, how bad it is, so I get punched in the face and I have a concussion, but I say I don't want to press charges, but the cop's like, oh no, that was heinous. We're arresting this person for assault, no matter if you want it or not, because it's still assault, whether I want to press charges or not. They still broke the law. So
Right.
I did finally convince Jen Boaz that she needs to report every single workplace violence to police. So they did call, and actually the way I got that is Colleen, I talked to Colleen, I'm like, Colleen, you need to talk to them about doing this. Like, call the police department and tell them that there's going to be an uptick because you guys are going to start reporting every single one. That's what the law says. And so now they are reporting every single one, whether or not the healthcare professional wants to press charges. So I would push for that at Wyndham also.
Yeah, well, that's interesting. I'll have to see if she's doing that here and has done that. I find that with talking, it's funny because now we're doing all these wanding, it's a matter that the big thing is, well, where are we going to wand these people? And I'm like, does it really matter? You need to set the precedent that when anybody first of all, I believe anybody should be wanded because violence is huge, regardless of in the healthcare setting or not right now. It's a very volatile world at this moment. But there's this notion that, I mean, it's huge right now in healthcare. You come in and you want, but if we're going to do it where we do in the emergency department, it sets the precedent that this is the rules. We're not joking around with it. And we take our staff and the protection of our staff to the utmost, I guess, capacity that we can. And it's not about feelings, it's about safety. And I think that's one of the biggest problems that we have in healthcare today is this whole concept of patient satisfaction and not disrupting that. And the whole idea of what healthcare is about, including safety and violence, is disregarded in the decisions that they make. So I think that's always the biggest argument that we have going back and forth with the hospitals. But I do have to say, we have worked pretty well with security lately. We were supposed to have security always in our behavioral health unit if we had somebody there. It always falls back and it doesn't happen. So there's still a lot of work to do.
That's
But thank
crazy,
you.
Andrea, because we finally won that. We now have a security guard that is in our psych pod 24/7.
I know, and we've had some very I don't want to say necessarily violent, but some people that are very hard to control that we just don't have the means to do it. And one of our security guards says, maybe we should transfer them to Bacchus because we're doing really well down there. They've really built it up.
Yeah.
That would be great.
All right, well, thank you. Let's let David, he's been waiting for a little bit. And then Connie.
Oh, thanks. My name is David. I'm an emergency room nurse at Bacchus. And I just wanted to clarify, you guys have been discussing it a little bit, but what does the law specifically say about this reporting? Is it assault? So that means there has to be physical violence against somebody. So if you could clarify that. Secondly, Sherry, maybe you can answer, is it the individual that has to make the report, or is it the hospital now? That's my second question. And then third, if someone's drunk or high, does that count as a mental illness? Because a lot of our assaults, or some of our assaults, happen when someone's drunk. Like I got kicked really badly by a drunk guy, for example.
Okay. You have a couple of questions there, and I'm probably going to miss some of them. Let me repeat back what the law says. The employer must provide the names and addresses of those involved to the police. Acts committed by a person with a disability whose conduct is a clear and direct manifestation of the disability are excluded. So I think you could easily argue that someone who is under the influence but is not technically disabled, and I think we would have to go to the ADA for a definition of disability. I don't know whether someone who is addicted would fall under that.
They don't. They
Okay.
don't. I've talked to police officers about this. Being intoxicated with drugs or alcohol is not an excuse for breaking the law.
Right, and that I would say is sort of that's the cop version. It would be great to confer with the attorneys just to find out, because I haven't read the ADA, and if someone has been diagnosed as having substance use disorder, it probably doesn't apply here, but it would be good to know for certain. And unfortunately, I don't remember them addressing that specifically a few months ago. So I'm not saying it's not possible, but the whole thing is around the definition of disability. So you had some other questions there, David. What were the others?
And the other question, since it seems we're ambivalent about the alcohol component, is the definition of assault, is that actually you're getting physically harmed? And then secondly, who has to do the reporting? Is the onus on the individual, or is that the onus on the organization?
The employer must do the reporting to the police in this case. It also, I think I have a truncated version here in the fact sheet, but I did provide a copy of the language, the law in the toolkit, so we can check on that to be sure. I know that the law refers to certain, CCB 3-1, for assault. So that is defined. So as far as, this particular part of the law where, the employer must report stuff to the police, assault and related offenses is defined in the statutes. It's clear that it's the employer's duty. Disability is there, and there would be a definition under the state, state statutes for what disability covers. So that part, even though I don't have all the answers for you right now, that's not too wiggly. Now, unfortunately, the larger issue is that this state law does not define workplace violence at all. Let me pull up something here for you for a second. I kind of discontinued the Zoom, but let me. Now you're looking at. Oh, good. You're looking at the Zoom or at the
Yes.
at the PowerPoint, and not a Word document, I hope.
Right.
Okay, good. Because all right. So this is the NIOSH definition. So violent acts, including physical assaults and threats of assaults. The OSHA definition is pretty similar. The Joint Commission one, I think, also includes threats. So I believe that OSHA's definition includes bullying, which, in terms of just trying to get a law enforced, I think that's probably a little bit too far. So I'm going to let Connie. Connie's been waiting for a little bit, and then Bill. Thanks. Oh, can't hear you, Connie.
You're muted, Connie.
There we go.
Connie, we can't hear you.
Right. Connie, can we let Bill talk and then maybe see if you can adjust your volume or something like that, because we cannot hear you. Oh, there you go.
Very cute.
Can you now? Okay, Bill, you go. Sorry, Connie.
Sure. The one thing that I did just want to add right there, when you said that, let management do their reporting and everything else, I'm sorry, I disagree with that wholeheartedly. The person who's been injured or assaulted, in my opinion, should be pushing, because on more times than I've seen not, management will try and make stuff like this go away. I mean, I've seen the police in the emergency room poo-pooing stuff and just trying to talk it down directly after being in a room wrestling with a patient.
Yeah.
So
We're not saying
I think we have
we're
to
leaving it to
put some of
management.
the onus on ourselves and say, you know what? Yeah, because we can't trust management to do what management says they're going to do.
No, we're
I
not
hear
saying that. We're not saying that we should hand it over to management. But the law says that even if we don't, they're supposed to.
Yeah.
I'm
And
not
I'm
saying we
saying they're
should leave it
not.
to them,
Yeah.
but I wouldn't leave it to them. I'd be making my own complaint, but I'm also pushing for them to do what they're supposed to do.
Yeah. So yeah, I mean, I think that both of your points are valid. I mean, it's clear that the law says the employer is supposed to do it. The other part of it is, yeah, that the police will poo-poo, and we know very well that if they get assaulted in the course of doing their duties, that counts. It's like they walk in the door and magically it's immunity for everybody, right? That's not fair. And I think it's a vestige of the sexism that, somehow, you're supposed to be taking, this is part of your job because, you're caring for everyone. So Connie, want to try it again, take it off mute and see if your volume issue is resolved. Sometimes, I know, playing with the buttons helps. Okay, are you talking? Because we want to hear what you have
Maybe
to
you
say.
have to log out and log back in. That might help if you make sure. Sometimes that helps.
Yeah, I'm sorry, we cannot hear you. You could put it in the chat or log out and log back in. And I hate to have you do that, but if you can put it in the chat. So David had another question, I think, but now he took his hand down. Maybe that was just from before. So, you know, where were we? I think that, let me take a quick moment to show you, dear Sarah, you need to understand. I'm going to show you this. And many of you have probably already seen it. Are you seeing the hierarchy of control?
Yes.
The inverted pyramid? Okay. So this is the framework that OSHA and NIOSH and all health and safety people use. The idea is that you're using the most effective means for whatever the hazard is, whether we're talking about violence or chemical exposure or whatever. So, you know, for violence, you can't really eliminate the hazard other than possibly getting the most high-risk patients, you know, moved to a high security facility, you know, a psychiatric hospital that deals with forensic patients, for example. But with violence, you can, well, and you can't really substitute the hazard either. So it's engineering controls, which basically means the use of technology to create a barrier. And it could also mean using technology for communications, and then administrative systems. Right here it says systems of work. We tend, this is I picked the wrong one. We tend to say work practices or administrative practices. So that means, for example, at Danbury, not allowing patients to get, you know, to go into the elevator with just one staff person, right? Going back to an incident that happened several years ago with a psychiatric patient going from one unit to another, and coming out and assaulting someone, or the potential to assault a worker while that worker is alone in the elevator. PPE is, you know, there's not much that can be done with PPE to protect you. I mean, in some cases, like in psych facilities, they have plexiglass shields and so on, but it's really engineering controls. So that's things like automatically locking doors, panic buttons, you know, plexiglass barriers around the nurse's station, stuff like that. Systems of work is preventing people from working in isolation, stuff like that. So I'm sure you're more familiar with all than that than I am. So I'm going to stop the share. So, all right. So Mitch had a comment in the chat. Maybe there should be a push or a requirement for the employee to get a copy of the report. Yeah, that's a good idea. And Connie's, with short staffing being a major problem, the employers should put the blame. Yeah, it is the employer's fault, really. I mean, often stuff, you know, when stuff gets really tragic, they'll say, oh, you know, this was a horrible accident and tragedy, and who could have foreseen this could have happened? Well, these are predictable incidents, and that's why we look at the data, because we know that people coming into facilities when they're under the influence or they're really frustrated because they've been in the emergency department waiting room for 12 hours, these are predictable incidents, and it's the employer's obligation to deal with it, to prevent it. So let's see, are there, what is this? Nope. Do people have more questions? I mean, I can babble endlessly.
No, I do want to say one thing though, because I know at least Hartford Healthcare has this, and I don't know if Yale has a version of it. It's called the Mutual Care, Mutual Respect Policy.
Mm-hmm.
So I took a really close look at that and read it the other day. And because I had an incident with this patient who was just over the top, like very labile, swearing, aggressive, had cut themselves to the point where blood was going everywhere. It looked like Texas Chainsaw Massacre in that room. And, we were putting ourselves at risk of bloodborne pathogens. It was just a really bad situation. So then I was reading it a little bit, and it does say in that policy that the hospital has that if they are presenting themselves for emergency treatment, then you cannot kick them out or any of that stuff, which we all know from anyways, mental illness. But the point of this policy was that if they disrespect us, we're not going to treat them. Well, with that little innuendo that, like, if you present for emergency care, well, anyone who comes to an acute care hospital is presenting themselves for emergency care. So it's like their little, I just caught that little glip of what they did there. Like we're trying to act like we're really supporting the staff and that we're going to stand behind this, making people treat our staff well. But that little thing, that little sentence just gives them the whole, like, to back off a bit,
Yeah, the cover, yeah.
Yeah. So I have yet to hear of one person, no matter how they talk to us, be kicked out of the hospital and refuse treatment.
Yeah.
Now I know by law, they have to be medically cleared first. I mean, this woman would never have been medically cleared at that point anyways, but I've yet to see even one person since it's gone into effect be asked to leave.
Yeah. David had a question or comment.
Yeah, just a clarification. Well, first comment, I totally agree that we should push staff members to report to police if they're assaulted, 100%. But if we do that, if the staff member reports this to the police, does the hospital then still have to make a report, or does that count as the reporting incident?
Well, I think that it's clear that the employer has a duty to report it, regardless of what the person does. Does that answer that? There's something else I've been meaning to say. It is hard with police, with prosecutors, to take this seriously. And years ago, PEF, our affiliate, one of the affiliates in New York, when they had a big campaign around workplace violence, they made a point of reaching out to prosecutors, to sheriff's departments, to like chiefs of police throughout New York State to say, this is the law. We'd like to meet with you to educate you on the issues around this and why it's very important for you to enforce this law. That said, I was told a number of years later by a local leader there that that's still an ongoing process to get police to take these situations seriously, because what that leader told me was something along the lines of, they stroll up, they see an intellectually disabled adult whose behavior has escalated. And I say, I'm not gonna arrest that person. They're not responsible for what they're doing. And the union's response to that is that is not up to you to determine. You are there to enforce the law. Let the judge then determine whether or not this person is responsible for their actions. So unfortunately, that sounds like it's just an ongoing issue to get police to, respect that you have just as much of a right to go home in this, the same shape you arrived in, as they do. So, Dale.
My question is, what the hospitals do with, so say somebody comes in, and it's documented, the police get involved, they're charged with an assault, but then they come back again. They're repeat offenders that in the community, when you live in a small community, they're going to come back to the same place. And they may have an underlying mental health issue. It seems like that's a big problem in our small community hospitals, that because of lack of our staff are getting injured by the person who doesn't get charged with the assault part, you know? I think everybody, I know because of just dealing with problems in our PES department.
Mhm.
And then I just wanted to point out also what upset us, and I work in a NICU. Now, you know, you wouldn't think you deal with a lot of workplace violence, but you do deal with parents that are upset, especially with COVID and the visiting, and you
Mhm.
know, their birthing plan went awry, and you know, what you never know what's going to trigger people into being a little irate in the workplace. But we had a gentleman one night who was very threatening, and we found out after dealing with him for several days that security knew he had shot someone down on Bank Street, and he was in the process of, nobody shared that information with us, which I thought was really wrong. If security knows of a known criminal walking around in the hospital, they should share that information with us, just like we do share pictures of infant abductors or people looking to steal babies. They'll send us photos of them.
Yeah.
I think it just that was upsetting to me, where we could have really, we didn't know if this man had a weapon on him. After the fact, we were really concerned. But that stuff, you never know the way people act. We deal with a lot of volatile.
Yeah. Is there some kind of red flag system in the data, program that you use?
I
mean,
mean, that's what I know of. I mean, he was a
That's something
visitor
that
at the
we have-
time because he was the father of the baby, you
Yeah.
know? He
Yeah.
wasn't the patient.
Right.
But it was the fact that we knew that we found out, you know, I mean, I suppose if I read the paper more, but sometimes you don't read the full paper as much as we used to.
Yeah. Well, that's one thing. So I know, for example, there's a psych facility we represent in New Jersey where they have a place in the electronic records, a red flag for somebody who's violent. Now, in that place, they needed to change it because there were, so many people, like all of the patients at one point or another, basically had been violent. They needed something. It's like, this person's been violent within the last quarter or something. So Mitch has a question or comment.
I don't think we have anything like that, though. Yeah.
I just want to comment on what Dale was saying about the red flag or the in the charts. There is a way, and it's sometimes shows up as an alert to a patient. But as was mentioned, it was a comment that patient acted violently towards staff, but that was 12 months ago. Okay, we don't know what the patient is going to be like today when they come in. It also doesn't have anything on visitors. The visitors are screened even far less than the patients, and they're wandering all over the hospital, especially on off shifts. They have a completely different standard at my hospital, L&M. During the day, people come in for an outpatient procedure, lab work, diagnostic imaging. They're checked in downstairs. They're given a wristband. They and their family members somehow wander around to get to where they're going. But in the off shifts, the off hours, same type of exams are offered, but due to short staffing, they just are wandering around the hospital literally, and they're lost. They have no check-in. They are not given a wristband, and you don't know who these people are wandering around the hall. So that's what we have to deal with. And I'm not sure what the fix is, but they should have the same standards on the off shift as they do during the regular shift. And how do we know about visitors and outpatients?
Right. Well, I think, you need to have more than one system, right? It would be great to have some kind of red flag system, but that can't be the only one. And you need to have enough security officers, enough security cameras that are functioning and are being observed, right? And, you know, maybe a sign up saying, you know, we expect everyone to act respectfully and, you know, no violence, you know, words to that effect. You know, a strict no gun policy that's posted at the entrance, and that, you know, stuff like that. There are lots of things. So I really appreciate everybody's time. It feels like, I don't know, do people have more questions or comments? I want to, you know, thank you, because I always learn a lot from leaders and members. And I guess I just want to, you know, try to pep you up, because I know, one, it's been a very hard slog. And people don't have a lot of energy. Members are tired. Everybody is kind of burned out. And this is really hard, but you have a really good tool here. It's just unfortunately a tool that requires a lot of work. And you all, you know, have more on your plate than you really ought to. And, you know, you can, you know, find somebody who is interested in helping you and serving on the committee, someone who might be the one who analyzes the data for you. You have a tool that, you know, is probably as good as what the eventual federal standard will be. And I wish there was an easier way to stop workplace violence. I wish we could stop it completely, because really it shouldn't happen at all. But it's a difficult problem to solve, and it just requires a lot of you know, banging your heads together with management and saying, you need to pay attention to this, and we need to have a rational plan for addressing it. And I just want to keep helping you with that. I'll email everybody the resources tomorrow, so that if you missed getting it in the chat, you'll get it that way. And please let me know what you find, because folks are always very interested in the reporting thing about the police. I don't know a lot about what has happened, you know, with that. So it'd be good to hear from you what happens related to getting the employer to report stuff to the police. What else did I want to say?
Hey, Sarah, can I just say that
Sure.
Bill, Kathy, and Andrea, I gave them my link. So I don't think they had a link. So when you send out the stuff, I don't know that they're going to get it. So can you just maybe add their emails?
Bill, I'm sorry, Heather.
No, Heather had it. Kathy,
Okay.
Bill, Kathy, and Andrea.
Okay.
Same with Jean Wheeling for me. She's under my name.
Okay. I'm not sure if I got their emails, but
Sarah, you have
know,
my email.
well, no, I know I have those other folks. I do have your email. I have you on speed dial, if that's still a thing. Speaking of which, I need to
Andrea.
Maybe Kathy and Andrea,
dropped
just
hers
put
in the
your
chat.
email in the chat so she can send you that information.
Yeah, that's great.
Yeah,
So what else
Jean
did I want to say?
too.
Hey, there's one
I
other
don't see
thing.
Jean on anymore.
She's the second Dale Cunningham.
Oh, I see now.
Yeah. Well, I guess I'd say that if someone, if you suspect someone didn't get it, you know, pass it on to them. And I think that, you know, so it doesn't actually look all that great right now. We need to get it formatted so that it looks like an AFT Connecticut document, and make this a really usable thing. I'm hoping that folks use this. Again, it's not perfect, but you've got a lot more than most folks do in terms of making the employer address this. And I want to tell you something else. This has nothing to do with this particular law, but 2 weeks ago, OSHA held what's called the Small Business SBREFA. So it's basically whenever OSHA is working on a standard, they have to do a process where small businesses get to weigh in on the impact of the law for them. And guess who claimed to be a small business? Starts with a Y, and I believe is like one of the 2 biggest healthcare
Please
employers.
don't tell me Yale. Please do not
Yeah.
tell me that Yale claimed to be
Yeah,
a small
I don't know
business.
what they testified. It was like 2 solid weeks of employers
I
weighing
cannot.
in on this, but I'll send you the article that that quotes somebody from Yale that like, oh, this is just so onerous, and it's duplicative because the Joint Commission already has standards, and oh, it's too hard. So
Wow.
yeah, it was shocking to me that obviously OSHA was not doing their due diligence to keep the big employers out of there. I don't know how they squeaked through there, but I guess that's what happens. So I leave you that so that you know that you got to keep fighting, and please let me know what tools you want from us so that we can help you with that. So thanks everybody, and I'm going to stop the recording, and I'll keep the chat up for a little bit so I can copy people's emails, and I'll send you out more resources tomorrow. Thanks everyone.